Going home can feel daunting, and this is where the planning and organising before you come into hospital comes into its own, so you can continue to recover in your own home with appropriate support. Please ensure your family or friends are available to collect you from the ward and take you home. Hospital transport can only be provided in exceptional circumstances. Your discharge pack. Your discharge pack includes medication, the medicines you brought in and any that we've started you on, plus a prescription for any medication you still require to take for the next few days. You will be given a yellow canister to safely dispose of the needles from your blood thinning injections. This can be disposed of at your local pharmacy once the course of injections is completed, or brought back with you on your outpatient appointment. A discharge summary. You will be given a copy of your discharge summary report, and a copy will also be sent to your GP. A wound care pack. This will include waterproof dressings and staple removers. Waterproof dressings ensure that you can continue to wash and shower after your procedure. The majority of you will have staples to close your wound. That will need removing after 14 days. This can be managed by your practice nurse or your district nurse, or maybe even one of our hospital at home team if you were within our catchment area. This again will all be discussed with you before your discharge, with plenty of time for you to ask questions and make sure you know what's happening. Personal care. The majority of patients are independent in personal care after surgery. However, if you are having difficulty with washing and dressing, a referral can be made for a package of care to be provided from your local social services, and we will ensure this is all ready to start on discharge. If, however, you have your own carers, please make sure they can restart on your agreed date of discharge.